Hey everybody, today we're going to talk about cerebrovascular diseases. In short, we call it CVD. So, talking about the brain, we have to know how selfish our brain is. It needs such large amount of oxygen and glucose. In short, we can say it's highly dependent on oxygen and glucose. It's such a selfish organ. It made 50% of filtered oxygen and glucose, and it also has collateral blood flow known as circle of Willis. And now talking about cerebrovascular diseases now. It has global cerebral ischemia, global cerebral ischemia and transient ischemic attack, and the last one, stroke. Talking about global cerebral ischemia, as we all know that cerebrovascular diseases is the third most frequent cause of death. And the risk factors of cerebrovascular diseases are similar to those risk factors of coronary artery diseases. For example, smoking, hypertension, diabetes mellitus, obesity, and one of the most important one is physical activity or physical inactivity, right? And low HDL, and sometimes age plays a role. In males it will be more than 45, and in females it will be more than 55. Talking about global cerebral ischemia. Okay, now let's see how it's been caused. Decreased blood flow. It's caused due to decreased blood flow to the brain. Now, how the blood flow to the brain has been decreased is,
for example, imagine somebody has been in an accident, and the major arteries have been damaged, and the blood leaks out of the blood vessel. So that's how it is. So decreased flow to the brain happens. And other good example we can take is shock and cardiac arrests, etc. While the entire brain can be damaged, but there are some places which have particular vulnerability, like Purkinje neurons. Where are Purkinje neurons present? In cerebellum. And we have hippocampus. Hippocampus is responsible for the storage of long-term memory. Very important for every medical student, right? Yes. And you know about the watershed areas, right? The pathology of course involves the watershed areas. Now, what is this watershed areas? This for understanding purpose, let's make it very simple. This is a tissue. And this tissue is supplied by dual blood supply. This is supplied by dual supply. This is called watershed areas. Now, in this global cerebral ischemia, what happens is, normally, first let's talk normally. If this vessel is been infarcted, and this other blood vessel supplies the blood flow, but in global cerebral ischemia, what happens is these both don't give a constant blood supply to this tissue.
So when the tissue is not being supplied constantly with the blood, ischemia and infarction occurs. That's how global cerebral ischemia leads to death. Now let's talk about transient ischemic attack. Now what is transient ischemic attack? Transient ischemic attack is due to atheroemboli. It's due to atheroemboli, and this is how the blood flows. Usually this condition is reversible. Symptoms usually last not more than 24 hours, so less than 24 hours. So prognosis is pretty good. Good prognosis. Now talking about the stroke. So in stroke, as we all know that infarction and hemorrhage. Infarction and hemorrhage. And infarction, again in infarction, it is due to, an infarction is due to thrombotic occlusion and embolic occlusion. Okay, now let's discuss about thrombotic occlusion. Now what happens in thrombotic occlusion is, it's due to atherosclerosis of cerebral arteries, which is characteristically called as thrombotic infarction, or it's characteristically called as infarction of white. Okay, what is white infarction? Now this white infarction usually occurs in wedge-shaped area.
Okay, it is due to arterial occlusions and in order, I'm sure you know about the red infarct also. It's due to venous occlusion, usually seen in tissues with dual blood supply. And now white infarction is due to arterial occlusion, usually seen in heart, spleen, and etc. Okay, in this wedging infarct, how it happens is, now let's say this is a guy, right? This is the sulci of the brain. Okay, now in this area it occurs in a wedge shaped. Okay, this occurs in a wedge shaped area, so that's why it's called white infarct. And now talking about the thrombotic occlusion, it usually occurs due to this white infarct, and this can be due to the setting of the atherosclerosis of cerebral arteries. And now talking about the embolic occlusion. Embolic occlusion is due to the thromboemboli from the cardiac chambers, and it's less frequently due to atheroemboli. Okay, now this can be appreciated mainly in the hypertension patients. In the hypertension patient, what happens is the narrowing of the blood vessels occurs, and this narrowing is known as heline arteriosclerosis. Okay, now then the sequelae, what happens is small vessel disease. Okay, small vessel diseases, and eternally what happens is something called lacunar infarcts occur. Okay, now talking about we have finished talking about the infarctions, and infarctions are 85% of the strokes, and hemorrhages are only 15%, which are most fatal. Now the intracerebral or intraparenchymal hemorrhage. Okay, intracerebral hemorrhage, and clinical features of intracerebral hemorrhage will be severe headache, okay, and vomiting, nausea. The symptoms are with steady progression over 15 to 20 minutes. It most frequently occurs with hypertension, and it most commonly involves basal ganglia, okay, basal ganglia, cerebellum, okay, and also it might involve pons. Having been discussed all of this, and we need to differentiate the basic cerebrovascular traumas, okay,